Hello, and welcome to A Guide to the More Than Mood Depression Symptoms Toolkit. My name is Valerie Cordero, and I am Co-Executive Director of Families for Depression Awareness. We created the toolkit to help family caregivers, people with depression, and the general public learn more about the cognitive symptoms of depression. This video will be divided into two parts. During part 1, I will tell you a little bit about Families for Depression Awareness and the toolkit. Then you will hear from the Executive Director of the National Association of County Behavioral Health and Developmental Disability Directors, Dr. Ron Manderscheid. Dr. Manderscheid will discuss why family involvement is important when dealing with depression and its symptoms, why families should learn about the cognitive symptoms of depression, and how county behavioral health and developmental disability directors can integrate the toolkit into their work to help their communities. During part 2, I will take you step by step through accessing the toolkit via the familyaware.org website. I will also show you each element of the toolkit, and I'll describe the purpose it serves. Let's begin. Families for Depression Awareness is a national nonprofit organization helping families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. We know that patient outcomes improve significantly when they have family support. We strive to offer actionable advice and training to caregivers so that they can be a positive force in the lives of their loved ones. So most people know that depression can affect one's mood, and they are usually familiar with certain mood symptoms such as sadness, irritability, or anger that can sometimes accompany depression. What many do not know, however, is that depression can also cause cognitive impairment. Caregivers notice, or they may notice, that their loved one is having trouble remembering appointments or paying attention during a conversation. So we developed the More Than Mood Depression Symptoms Toolkit to help caregivers better recognize cognitive impairments and intervene successfully. Now we're going to have a Q&A with Dr. Ron Manderscheid. So thank you for joining us today.
Yeah, thank you very much for inviting me.
So, Dr. Manderscheid, why is family involvement important when a person is diagnosed with depression, especially in cases where cognitive impairment could be a factor?
Well, as you know, depression is a very, very prevalent disorder in the American population, and at any one time, probably as high as 11% of the population has some form of depression. And if you look over the lifetime, probably about 20 million people will have depression, during their career. So it's a very, very prevalent thing. And one of the characteristics of depression is that people communicate less with others in their environment. So it's very, very important that families understand the signs and symptoms of depression, including the symptoms of cognitive impairment that frequently occur with depression as well.
Great point. Moving on to talk about family education, can you touch on why it's also important for families to learn about the symptoms of depression, including the mood symptoms and as well as the thinking or the cognitive symptoms?
Well, I think, many people are sensitive that their family member is not doing well. They may be less sensitive to the particular signs and symptoms of depression or other illnesses. And it's important to, make the point here as well that if the person has depression, you want to recognize the appropriate signs and symptoms and take appropriate action. But you also want to differentiate if the person's really suffering from some other disorder. They have an anxiety disorder or they have bipolar disorder and so on. You need to be able to differentiate that. And the only way most family members will be able to do that is by learning the signs and symptoms. Similarly, with cognitive impairment, typically when people have cognitive impairment, they tend to try to hide the fact that they have cognitive impairment, not remembering people's names or not remembering particular dates and so on. So the family member needs to be trained to recognize these signs and symptoms that, this process is occurring for their family member, and that they'll actually be able to then, intervene to do something about it. And I want to also point out here that, and I'm sure all of your listeners know, depression and cognitive impairment with depression is not a death sentence. It doesn't mean you're always going to have depression or you're always going to have cognitive impairment. If you get good, appropriate treatment, for the vast majority of people, depression can be controlled, and the cognitive impairment associated with depression can be controlled as well. So I would say the outlook is very good for people who get care, and family members play a very important role in that process.
Great. Those are wonderful points, and we also like to always emphasize that help is out there, and that when families know what kind of help to look for and how to best be supportive of their loved ones, the outcomes for the person with depression are vastly improved. So we do always want to offer hope to people that it can be better. So let's speak specifically to the community or the organization that you represent, Dr. Manderscheid, particularly the National Association of County Behavioral Health and Developmental Disability Directors. Sorry about that. So you represent this organization, and it works to improve access to, funding for, and quality of behavioral health services, especially for those people who may be in vulnerable communities. How can members of NACB-HDD and their clinics take advantage of this free resource that we are offering and use it towards this goal of improving access?
So first, I want to say a little more about NACBD, the National Association of County Behavioral Health and Developmental Disability Directors. We represent about 2,000 county directors of mental health, substance use, and developmental disabilities. And these 2,000 county directors of mental health and substance use and developmental disabilities are responsible for the behavioral health for about 75% of the U.S. population. So it's a huge challenge to get the right care and get the right care delivered and have the appropriate resources and so on. So we're always seeking support for what we're doing, both, in terms of better appropriations at the county level, but also better participation in Medicaid and better financial participation at the federal level in the work that we do. So to your particular question here, I think one of the things that will be very important to us, we want to use the tools that you're developing. Number one, we need to make our directors, our 2,000 directors, aware that these tools are available. And they're particularly important tools for our directors because our directors have a lot of contact with family members. Our directors spend a lot of time talking to various family groups, working with family groups, working with parents of children in the school system, and so on. That goes with the role of being a county director. So if we can arm them with the right tools, we can use those tools to actually have the tools made available to family members in their respective communities, so the family members then have greater awareness of the issues that we've been talking about, symptomatology and cognitive impairment and so on, and that their family member can get better care. And again, I would want to emphasize, counties try to do the very best care that can be provided for people who have depression, including those who have depression and cognitive impairment.
Yeah, they play such a crucial role in helping to match families with the services and the care that they need. So we are really hopeful that the directors will find this toolkit useful, and that the families that they serve will also similarly find it useful. So now we want to, of course, thank you, Dr. Manderscheid, for talking us through some of these issues and looking at how this toolkit can be used by the directors across the country. We're now going to transition to the video tutorial. And during that tutorial, I will take you step by step through how to access the toolkit on the familyaware.org website and through all the different elements of the toolkit.
So Valerie, thank you very much for inviting me today. Best of luck on your toolkit.
Thank you.